Hello, and thank you for joining us tonight for our free webinar, Neuro-Acupuncture for Treating Post-COVID Syndrome and Challenging Neurological Disorders, featuring Dr. Jason Howe. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speaker, please make sure to use the Questions tab to the right of Chat to assure that we see it at the end of the lecture. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speaker. Dr. Howe has been practicing and researching scalp acupuncture for 37 years and has been teaching classes and seminars in the United States and the West since 1989. He has trained hundreds of acupuncture practitioners and treated thousands of patients with disorders of the central nervous system. He specializes in treating neurological disorders such as stroke, multiple sclerosis, Parkinson's, traumatic brain injury, PTSD, cerebral palsy, autism, complex regional pain, and phantom pain. Dr. Howe currently serves as the president of the Neuro-Acupuncture Institute in Santa Fe, where he has trained more than 300 practitioners to specialize in neuroacupuncture. He is editor-in-chief and translator-in-chief for the book Acupuncture and Moxibustion, published by the World Federation of Chinese Medicine Societies. He was the former chairman of the Acupuncture Committee in the NCC-AOM. He's a former president of the board of directors at Southwest Acupuncture College, and he's the co-author of the book Chinese Scalp Acupuncture. And lastly, Doug Dirth has just released a documentary film called Return to Life on Jason Howe and his wife, Linda Howe. Please join me in welcoming Dr. Jason Howe.
Hello, everyone. I'm Jason Howe, the president of Neuro-Acupuncture Institute in New Mexico, America. Welcome, everybody, join me tonight to discuss post-COVID syndrome and difficult neurological disorders. I've been in the United States to teaching, researching, and practice for 32 years. And I'll teach in many parts of the country, and Europe, Dubai, and Australia, Canada many times to similar topic. The bottom of this slides is very important information for all of you. www.neuroacupunctureinstitute.org. So you can get more information about our class and myself and a lot of film there, and contact our executive director of Asia there, okay? Since 1989, I come to United States to teach. There's many newspapers, TV, journal report, and radios have reported the neuroacupuncture treat a lot of neurological disease. And some of the newspapers have been reported about us. Our documentary movie just released a couple months ago called Return to Life. If you're interested about what we're doing and want to educate your patient, your colleagues, and introduce this to other profession, you can go to vimeo.com on-demand return to life, or order this, or rent for this. And today we're going to play a little bit trailer about these movies, and we discuss all the patient, their life returned, they have new life, and you will like this movie. Today we're going to talk about neuroacupuncture for treat post-COVID syndrome and difficult neurological disease. First, we will know the definition of neuroacupuncture. Before we started, you will see many of the slides, include all the artwork. Chinese calligraphy is mine. So I'm also an artist as well. Neuroacupuncture is a contemporary acupuncture technique integrating two things. One, with traditional needling stimulation technique with Western medical knowledge of neuroanatomy, neurology, and neuroscience. Neuroacupuncture has been proven to be a mostly effective technique for treating central nerve disorders such as stroke, multiple sclerosis, Parkinson's disease, traumatic brain injury, PTSD, cerebral palsy, autism, and phantom pain. Neuroacupuncture also very effective treat post-COVID syndrome. Today I'm going to use this 1 hour to quickly introduce neuroacupuncture, the major part of neuroacupuncture, scalp acupuncture. Also, we'll touch some body acupuncture a little bit, and we'll mainly introduce some useful areas for scalp acupuncture, how to insert the needles, stimulation, and most common use, clinical applications. I have the book, if anybody want to learn, and it's on the side there, it's called Chinese Scalp Acupuncture. This book has been used in many schools as a textbook, have been printed 11 times. So for more questions about what I'm doing, how they use, how the technique, you can order this book in Amazon. Scalp acupuncture is 17 areas. We don't have enough time. We're going to introduce some of them. That's on all the chart from the comprehensive Chinese acupuncture books. So that book only has 4 pages. It's not enough information. Many of them maybe wonder, this scalp acupuncture is very useful, effective. Why so many practitioners don't use that? The major problem, there's not enough good teachers know how to use that, how to teach that. Since last year, COVID-19 have huge impact on the world economy and health. There's so many people suffer from this terrible disease and cause a lot of people die. Right now, you can hear there's almost 150,000 people caught this virus every day. There's more than 1,000 people die every day too as well. West medicine play a very important role to save people's life. However, there's many people they are survived from ICU. Up to 50% of them still have some symptoms after the release from ICU. In about 10% of mild or medium cases of COVID, patients also have symptoms. They together what's called post-COVID syndrome. And they also call, in normal people call their lung hauler. Patients have this post-COVID syndrome. Western medicine have a limited offer. Acupuncture have wonderful results. Since last year, I have treated a lot of people, have good results. The major manifestation in clinic I see people have post-COVID syndrome is their loss of smell and memory, loss of taste, anxiety, depression, and they also confusion. They normally call this brain fog, and they have insomnia. Many people have headache, dizziness, loss of balance, fatigue, palpitation, shortness of breath, all kind of neurological pain. It's just some of them. According to European research, most common post-COVID syndrome they have in their clinic is a chronic fatigue. Many people, even they are after from emergency, they still have shortness of breath, joint pain, chest pain, loss of smell, loss of taste, and many of them are feeling dizzy, loss of balance, and some people even paralyzed. So how to treat this long haul symptom and signs is a challenge to all medical profession, and many of them even disabled. Lately report that many children have suffered from COVID and they left their brain very confused. Many smart kids, they even cannot answer similar questions. So there's a lot of demand for this treatment, and scalp acupuncture offers excellent results for that. That's another report for different resources about how they affect many systems. Basically, this COVID-19 affects central nerve, brain. They affect upper respiration functions, lung functions, heart functions, digestion, and the gut. And many people even have the urination and the bowel movement problem as well. A lot of people, they're able to function well, have 2 or 3 some symptoms. There are many patients are treated, they just cannot performing normal functions in their work and their lives. So they challenge as well to medical profession. Before we talk about treatment for post-COVID syndrome, let's general review about scalp acupuncture, anatomy, and the physiology of the brain. Scalp acupuncture generally, we use cerebrum areas and the cerebellum areas. Cerebrum generally divided into 4 lobes we use in scalp acupuncture. Frontal lobe in the red here. If we review the front lobe, right here, gyrus called motor gyrus control the motor functions of the side of the body. And right here, further frontal lobe control all the mental activities that we are going to use for most COVID syndrome patients. They control the mental clarity, executive functions, sleep, emotional. In the blue areas, they call parietal lobe. That most area is motor gyrus right here, and they control the body movement. And in the purple area, control the eye vision called occipital lobe. Mostly we use for post-COVID syndrome, we use a lot in that green areas is called temporal lobe. They control the comprehension, hearing, and the body balance, and also part of that control the speech as well. Cerebellum, as you understand, they work out the balance and coordination. Most common used stimulant areas on scalp acupuncture, we use motor areas, sensory areas, Korean tremor areas, dizziness hearing areas, balance area, and the head areas. That is the green areas control the motor, the forehead right here, red area control the sensation. I need this a little bit big picture. Is Jeff, you can do that? People can see it. So it's a reading model about the brain. So the brain, mostly we use is structure is a deep press there called solicus. Okay, they're all solicus. Solicus divide the brain, raise up, called gyrus. So from here is a motor gyrus. Here is a sensory gyrus. It's a temporal lobe, superior temporal lobe gyrus, medium, and the inferior. Yes, here you can see the gyrus here control the vision, and in front lobe here we use a lot. They control the memory, concentrations, and the sleep, emotional, all these areas. Each side of the brain have projection area on the scalp surface. For example, the motor area of the brain have projected area on the scalp surface. That light. So right here is the motor areas. Right here is the sensory areas. Here is the dizziness vertical areas, hearing, and there's a speech areas here. And we're going to use a lot for these areas. So this all from hairline. Most of them you probably already learned that. We're not going to location that are too details, so we can save time to share how to treat them. All right, next slides, please. Jeffrey, good. So motor areas are the most common use areas on scalp acupuncture. To precisely location areas, I'm going to speed up a little bit. I think you get used to my Chinglish now. The other people, Chinese people talk English, have Texas accent. I live in Texas first 2 years. I carry that accent, never go away. Now, our institute located in Santa Fe, New Mexico. And so today I have the executive director, Asia, help me. Also, I have my associate, the secretary of Neuro-Acupuncture Institute, Thomas Hatcher, in the back there. And right here, and Asia and Thomas, and we work in the same office now. And most of them, you probably have questions. You can do it. Can we do it? And Thomas can share his stories if we have time. Okay? All right. So, and before I continue, and also I like thank Lasha OMS company hosted their teaching, and thanks Jeffrey Bloom to conduct this, arrange this lecture too. And thank you everybody to join us too as well. So precisely like these motor areas. So basically you want to find two imaging lines from yin tongue or glabella connect two occipital protuberance. Here you found the middle point. Posterior 0.5 centimeter, you found the upper point of motor areas. Then from upper border your elbow, make a horizontal line connect two occipital protuberance. You found the cross point on anterior hairline. At the lower point of motor area, you connect all there together. It's motor areas. Motor area, according to anatomy of the brain, you divide in 5 equal parts. Then upper 1/5, they treat paralysis, weakness of upper limbs, hand of this side, middle 2/5, control the leg and trunk and foot of this side paralysis, lower 2/5 treat of this side face paralysis. That motor areas. Sensory areas is the areas parallel to motor areas, 1.5 centimeter posterior to motor area. They equal to 5 equal parts, divide upper 1/5, middle 2/5, lower 2/5. This area is very common, treat a lot of neurological pain. Many people in COVID-19, they have the pain, travel around, move around, sharp and electricity shock pain. They work on, you can use relative areas. Tremor areas is the area anterior to motor areas, 1.5 centimeter, and parallel to motor area. They use for Parkinson's, for people who have COVID, have tremor, muscular tension, you can use these areas. And one area very important to treat post-COVID syndrome, as well as to treat people who have dizziness, vertigo, mania syndrome, is dizziness or vertigo hearing areas. You from apex top of the ear go up 1.5 centimeter, go anterior 2 centimeter, posterior 2 centimeter, total 4 centimeter in that. This area, people first time to learn or early to learn, need careful. Inside this area is the only area have the muscles called temporal muscles. So you have the superficial insertion, otherwise cause muscle spasm is very painful. Why we divide into 3 areas is according to anatomy and the physiology of the brain. So each part of the brain how represent the areas, represent the body movement and sensation. The more complex, commonly used in the everyday life, they have big area. You can see the hand, some have big areas, and compare that, the leg and trunk have small areas. Motor areas can treat the paralysis and weakness of the face, trunk, and limbs. In our clinic, I have treated a lot of people paralyzed. At least this according to frequency people appeared in the clinic. Most of them we treat people paralysis with stroke, MS, Parkinson's, cerebral palsy, traumatic brain injury, and spinal cord injury. Of course, there are some people from post-COVID, they have paralysis. Most of them, they are caused by encephalitis and meningitis. We have some patients to share that. And how do you treat paralysis and other neurological disease? Insertion of the needles is so important. Why most of you don't get good results and we did it? Because we know how to stimulate and insert in these needles. Thomas, if you don't mind, I do need your help me to get closer. And Jeffrey, we need a little bit close to shot, okay? So go ahead to have that. You have to. All right. And so Thomas, handsome guy. Thank you to help. So for insertion needles, important first of all, you need to know what needles we often use. In our clinic, we use Chinese needles, but you can use Japanese and the Korean, German needles as well if you meet this condition. Basically, we like needles have the wire loop on they have the loop there. It's easy to stimulate. For most adults, we use 1.5 Chun needles, and in Chinese needles is 34, 32. So some books said use 28 or 30 is much thicker that we use in China, but they produce a lot of pain. You need to learn how to do that, and then you get better. For children, we use 34, 36 numbers, and we use 1-inch needles. Scalp acupuncture tube not work at all. I repeat 1 time. Don't use a tube. You hurt more and you cannot control. So you have to use a freehand technique. That's the insertion needles. You hold needle there. And that's the sixth hand. You hold needle this. And how we do? Right there. Good. You can, yeah. So the needles insertion is horizontal. So from a scalp surface to the needles to your hand, there's about 15 to 25 degrees. That is assistant hand. You hold needle there, that's a puncture hand. Okay? Let me see what we can do. You can see it. So you push and rotate, and they cannot see it. And thinking we need right there, okay. That we maybe can do it. So you hold needle there and push and you rotate in. Okay. Nope, didn't get it. Push and rotate in. Right there. Stimulate needles. That's the gift for this class. If you never take a scalp acupuncture course teacher by master, you probably have trouble to manipulate needles. So stimulate needle here, you use don't do this. You never work. Okay? You have to use bend your needles, hold here, hand there, and you rotate like this. See it? Do this, they support, and rotate clockwise, counterclockwise, and 200 per minute. You get better results. So when you practice a long time, you can do two hand. You can do this way. You can do one this way. Use your dominant hand first. If you do this, you can see my hand. Now I can do quick. Okay, the results, that technique is the insertion needles and manipulate. If you can do this, and you get good results. And thank you, Thomas. Yeah, so later I have your question, you can do it. And there's many other techniques about how the insertion needles. That's what I teach in my class, two hand. But there's a Dr. Job style. They do it one hand, they fly needles. They fly like this way, push. It requires more technique. We'll teach that in level 3 class in our class. And there's a Dr. Fang style. Today I'm teach a Dr. Jiao style scalp acupuncture. There's 7 different type. And there's Dr. Fang style we teach in level 2 class. You use half-inch needles and you insertion like that. And it requires a lot of more technique. So in our class, we have every 6 to 8 people. We have one supervisor. We watch you, you puncture each other, we make sure you understand. After you learn the class, each class, you can go home, treat patient, get good result right away. That's the insertion and manipulation. Okay, we can back to PowerPoint, Jeffrey. Thank you. Can we back to PowerPoint? Yeah, no, just back there. I didn't see the part. Big screen, please. Can we get? That's it.
Are the slides not showing for you?
What? Yeah,
the slides are back up.
They work. They're fine.
Okay.
So that's earlier in 1996, 97, something like that. The New Mexican, many newspaper report us that that's the stroke patient I treated, and the bottom there, he get a few treatment, he able to get out and walk. So most of the patients I treat the paralysis with first 3 treatment, they usually have some improvement. So we have people have car accident, brain injury, stroke patient, and cerebral palsy, they completely recovered. So very, very exciting. None of other acupuncture technique can do the same results. Let me see what's that. Yeah, we covered that already. That's from my book. Oh, that. So how we located the projection area on the scalp surface based on different neurology. That's a chart I like to see. Most of them, this is sensory areas. So here is our leg, here the arm, here it will be for face. But there's some neurology believe that in the sensory area, upper 1/3 control the touch, middle 2/5, middle 1/3 control the smell, lower 1/3 control the taste. So for people lost smell, taste, that's one of the choice you can according to this chart to treat them. And of course, people lost hearing, tinnitus, I treat a lot. And after people have COVID, and you can use these areas. We can go a little bit quicker, then we can go to real patient. The balance area within areas very common to use to treat Parkinson's, MS, and post-COVID, they have blurry vision, loss of partial vision, double vision. You use vision areas. So locate this from occipital protuberance at the start point, bilateral 1 centimeter. Remember, 1 centimeter, talk about scalp acupuncture, never use the term chun, okay? Bilateral 1 centimeter, you go up 4 centimeter, then you go down from here, you treat any vision problems. So most of the time, the vision they left control right, right control left, but in the clinic, we use both sides. Another area is the balance areas. So from occipital protuberance, you touch your back of your head there, right there, the big bone standing up. And the start point of bilateral 3.5 centimeter as a start point and go down 3 centimeter is the balance areas. Balance area is a very common use to treat Parkinson's disease, multiple sclerosis, traumatic brain injury, or post-COVID. They have loss of balance, coordination problem, ataxia. You can use this. Most of the patients we treat in our clinic, after you put their needle, stimulate, they can see better right away. Okay? That human, really you can see the balance areas. Speech areas is relatively common too. We are going to introduce just 2 speech areas. One called speech 1 areas. It's a lower 2/5 motor area. They're also called speech 1 areas. They overlap. They treat motor aphasia. When people have the stroke, brain injury, or they have post-COVID, they lost speech completely, you use speech 1 areas. If they can talk, but they come out wrong words, you cannot understand them, you use speech 3. Speech 3 from a apex of the ear go up 1.5 centimeter posterior, 4 centimeter, that is speech 3. It's anything affect comprehension center of the brain causes speech problem. We have very good results to treat aphasia, and many of them completely recovered, so pretty exciting. Most of them predominant area for speech is left side, but there are some patients you use both sides too as well. All right, that's one of the patients I treat have stroke. Doesn't matter what you ask her, she always answer, my mom think I'm treasure. What's your name? My mom think I'm treasure. How old are you? My mom think I'm treasure. So after 5 treatments, she completely recovered, and there's one newspaper in local report me as well. Foot motor sensory areas is the most common areas to treat a lot of neurological disease because they cover upper, look here, they from occipital protuberance connect from occipital protuberance connected with the in-tongue point glabella. You found the middle point, bilateral 1 centimeter, you go posterior 4 centimeter is foot motor sensory area. If you look here, there's motor areas right here. this sensory area right here. Foot motor sensory area start from here down, here, down. Foot motor sensory areas is in up motor areas and the up sensory areas. They cover that. So the indication you can see that motor areas, that's a sensory area, that's a foot motor sensory area. So indication they can treat the paralysis, pain, numbness, any abnormal sensation. If you can use these areas. They also treat all the urination disorders like incontinence, urine, leaking urine, and even have bladder infections. You can use this area. Most common we use is multiple sclerosis. They lost control your urine. You put these 2 needles, they're feeling better right away. Also, for people who have the stroke, and they have this urination problem as well. They work for frequent urination, incontinent urine. Also, they work retention of the urine as well. They also treat bowel movement disorders. They use mostly incontinent bowel movement. They work for constipation. They also work for diarrhea and other bowel movement disorders like dysentery. They found some people have good results too as well. This area is very important for some sex function dysfunction like impotence, libidos, spermatoria. They also treat all kinds of paralysis of internal organs. Here, common use is uterus and the bladder. In Asia, we have a lot of diagnosis per left stomach, works well. They also work cervical spondylosis. In Asia, we call cervical syndrome. Lumbar degeneration, hernia, you can use that. They also treat skin disorders. We use that often treated for psoriasis, eczema, neurodermatitis, have good results. We treat a lot of children who have ADHD, adults who have OCD, and mental retarded children. You can use that. PTSD, post-concussion, post-traumatic stress disorder, and traumatic brain injury. Restless leg have good results. Dementia, fibromyalgia, seizure. These are examples. They almost can treat all the neurological disease. Okay. How to insert needle without pain, and it's very important you insert needles in the correct layers. According to anatomy, there's 5 layers of the scalp called skin, connective tissues, aponeurosis, loose areolar tissues, and pericranium. Scalp acupuncture, basically you pass the first 3 layers, go to loose connective tissues. If you insert this needle right, it will be very loose. Okay? If you put needle very tight, go to first 3 layers, it hurts. If you go too deep, go to pericranium, patient probably never come back. It hurt terrible. So make sure your insertion is 15 to 25 degrees, get these layers, okay? And you can see this chart in my book. All right, now we get most exciting part of this today. We're going to talk about how to treat COVID patient. Most COVID patient, and if they acute stage, Chinese medicine usually we don't have chance to treat them. but you still can give their herbs. You cannot see them, but you can check their tongue. Tongue diagnosis is so important. That's one patient have post-COVID syndrome in my clinic. That before the first treatment, you can see the right tongue, right tip, right side, thick white coating, slight yellow. So it damp heat somewhere, right? And after one treatment, no herbs, look at the tongue clear up. Okay? So what kind of symptoms and signs? Listen to patient, then I will tell you how to treat patient. Jeffrey, please play the film. Have the Rebecca and in the yellow shirt, please.
From Santa Fe, New Mexico, I saw Rebecca 2 weeks ago. Hi, good morning, Rebecca.
Good morning.
How are you today?
I'm so much better since you treated me.
Yeah, so you feeling very sick at the last year, I guess? February, you said?
February from the 26th through the March the 1st of last year, 2020. So
I believe you feeling like a fever, chills.
Feeling like a fever, chills, what?
Chills, headache,
chills,
I just couldn't
headache.
get no energy.
I just couldn't, no energy. I couldn't get out of bed. I was just so, I just never felt that
I'm
sick.
not usually sick.
Ever. I'm not usually sick.
And after that,
Okay.
you lost your
And
smell.
after that, you
Taste
lost your smell.
My
taste and smell.
Energy.
I
I
energy.
And you
I just
feeling
wanted to sleep.
dizzy, loss of
And you're
balance,
feeling
Loss of
dizzy,
balance,
loss of
dizzy,
balance,
loss of balance.
dizzy, loss of balance,
Cramping in my feet.
a cramping in my
and my
feet and my legs, and also the burning sensation on the bottom of my feet.
so the
Was
whole
just
body
unreal.
changed.
So the whole body changed. My whole
I
body
didn't really
changed.
understand.
And
what
I
was
didn't really
happening
understand what was
later
happening until later when
liked to
I
eat chili and I couldn't even
I like to eat chili and I couldn't even eat chili
so
anymore.
you have treatment 2
Okay,
weeks
so
ago.
you have
How
treatment
you
2
feel
weeks
after
ago.
that?
Oh,
How
so
you
much
feel
better. I
after
can
that?
walk.
Oh,
I can
so
put
much
on
better. I
shoes
can
and
walk.
not feel that
I
burning
can
sensation.
put on shoes and
I'm
not feel
having
that
a couple
burning
of cramps,
sensation.
but not
I'm having a
compared to what
couple
I
of
was
cramps, but
having.
not compared to what I was
just
having.
feel
I
100%
I
better.
just feel 100%
How your dizziness?
better.
My
How your
dizziness is gone.
dizziness?
I don't feel
My
like
dizziness is
balance?
gone. I
My
don't feel like
balance.
I'm
And
going
the
to
balance?
fall.
All of
And
a
my
sudden I used
balance,
to
I
feel
don't feel like I'm going to fall.
this
All of a sudden I used to feel
was
this
losing my
dizziness come
balance,
on, and I
haven't
was
had that
losing
since
my
I came
balance, and I haven't had that since
Any
I came
change
2
about
weeks
your
ago.
taste, your
Any
smell?
change
I'm
about your
smelling
taste, your
something.
smell?
I'm smelling some things,
Rotten bananas, I can
like
smell those.
rotten bananas. I can smell those, and I hadn't.
Hi, Dr. Howe.
Yeah.
Really quickly, can you press the little microphone button to mute your sound during the video? And then when the video's over, can you unmute yourself?
Sorry.
No, it's not your fault. It's just it's echoing the video. Once you're muted, I will replay or I'll put the video back on.
Okay. All right.
Asia, can you do that?
Okay. Now.
It's not muted yet.
You muted. Do we need to mute the?
Yeah, can you mute? It's the little microphone icon in the bottom left. Perfect. Thank you.
Smell 'em. And I'm tasting a lot better than I was before. I would put food on my, and then I would kind of play with it. I wouldn't eat it, but I'm finding out I'm eating a little bit more than I was eating.
Wonderful. Any change about your memory, concentrations?
I think it's improving. I think that's improving. I hope it is.
Yeah, thank you. Yeah, and your sleep?
My sleep is very good. I'm not going to bed immediately like I used to right after dinner or after I prepare dinner. I'm staying up a little bit longer, but when I get to go to the bed, I want to sleep, and I sleep. I might wake up to go to the bathroom, maybe some nights, but not like I was waking up.
Any change about your the energy?
My energy, oh, I have a lot more energy, a lot more energy.
That's good. And, so wonderful. I see you might have some change in your tongue. Did you notice that?
I noticed it was so white, and now
You show
it's.
your tongue. Look at that. It's so much better. And that her point. I use a foot motor sensory areas. And head, I use Dr. Jin 3-needle technique. I use Shenman and the lower two-field sensory work, smell, taste. Last time I used DJ vertical, he don't need it. There's new point here. We'll talk that have work on the smell too as well. Okay, and you can see the Shenman point is kind of red, so he still needs something treatment there. And thank you so much to share your story. We really appreciate that.
Well, thank you, Doctor Howe. I just knew if I got in to see you, I would be helped, because I couldn't. My regular doctor, there's no help at all. I couldn't get anything done.
Exactly. You notice some change about your urine. What happening?
Well, my urine is not as smelly as it was, and also it's not as. It was just vibrant, almost yellow, and almost an orange yellow, and it's not that anymore. It's
after before my treatment, so
yes.
That's a big change. Your body movement is okay?
My body movement seems to be okay. Yes.
Yeah. No constipation, no diarrhea.
No.
Okay.
Either of them. And good bowel movements lately.
Do you feeling any depression, anxiety?
No, I haven't. I really haven't.
Okay, that's not too bad. Okay.
Not too bad. No.
All right. Thank you a lot. Again, our best wishes. I think a few more treatment will make you more better.
Thank you. I do have 2 scheduled in May, so I'm going to keep them.
All right.
All right. So, everybody impressed with our herb? Only needles with the urination change, tongue change, anxiety, dizzy, fatigue, it all changed. So that you see the power. Here's just one patient able to film. I treat a lot of people have tinnitus, loss of balance, and loss of memory, foggy head is a very common chronic fatigue. There's no treatment there. TCM have wonderful potential for post-COVID syndrome. So prepare yourself. As soon as we educate public, more profession, everybody going to have more patients. It's not just a business. You change their life and return their life back to normal, have them back to work. Okay? And so I treated those kind of patients almost every day now, more and more. Actually, my associate Thomas Hodge too as well. Our clinic, normally I have about 3 to 6 waiting lists. Okay? Patients come from all over the world, after state come for the treatment. So after you know this technique, you don't worry about you have to struggle your patient anymore. And so it's pretty exciting. I have a chance to share this with you. Let's go to other disease. And you probably have a lot of questions, and we try. I think we have something going to come out about the article about how to treat the post-COVID syndrome. So let's see the technique location. So from here, you can see the foot motor sensory areas you almost use for all post-COVID syndrome. So the protocol, you use this for all patients, doesn't matter the complaint. Another one, there's a 3 needle here, is we call triangle 3 head needle technique. It's from Dr. Ji in south of China. I do need you shift to me to camera, Jeffrey, camera, you can.
So right now your camera is off. So if you can click on, there's a little camera icon.
Okay.
There you go.
All right. Foot motor sensory areas right here. From here, go back. Most important, I want to teach this class. Let me see if we can see. So you can see there's a 3 needle here. I move that so change the location. Sorry. I have to pull back. Okay. So basic, you do one like in scalp acupuncture. That's my location called head areas. So one old book doesn't describe. My book have that. If you don't learn this, get it from Governor channels or do channel 24. Shen Ting, right? Yeah. And in Chinese. So, and you from here, put 1 needles all the way back from hairline, go back. Then you make another 2 needles. One is from chest areas or thoracic areas on scalp acupuncture. You make a triangle inside. So you do needles, look the angle, okay? Inside like this. You can see it? Inside, the needles look like this, okay? One here, one here, one here, okay? So you do one from here to here. My inside make triangle. This work for people, brain fog, loss of memory, concentration poor, insomnia, and for people have anxiety, depression, you put these needles from hairline go down. So you do this way for people anxiety, depression, anger, all the emotion, you do this way. Okay, so that's a pretty common use point for this. For her, at the beginning, I also use upper 1/5 sensory areas. You have a lot of feet burning. And this one works for dizziness. Yeah, one here for dizzy. And you also can treat a lot of people for balance. That for scalp acupuncture, less needles is more effective. If you put 1 needles, the brain will respond 100% inside the brain. Put a 2, 50%. Put a 5, 20%. Many new practitioners put a 10, 20. You only have 5, 10% response. So patient won't get results. Okay, less is better. You don't have to treat everything. Actually, you put a foot motor sensory area. Even patient don't complain some symptoms, they're better too. Okay, the brain is very elastic. They can remap, rewire, restore all the functions. Okay, back to the slides, PowerPoint, please. Wonderful, thank you. You're great. All right, and what time is it? We still have time. And let's play another movie, Jeffrey, and play the longer one. Do we know which one longer one? Yeah. Yeah, we need a muted.
Hey, Doug.
How are you, man?
Good. How are you?
Thanks for having me.
Yeah, thanks for having me.
So this
Perfect.
Thanks for being here.
So this is the place, huh?
Yeah, isn't it beautiful? I served in the military. I was with the Air Force. Got into a tactical forces group. Went to Iraq. Had a lot of near misses. Had a lot of close calls, but one of them got too close.
She was at a restaurant in Bogota. There was a cartel-related shooting, and she unfortunately got caught in the middle of it and got shot in the back.
Dean was born 2008, everything was normal, pretty much. And on 3 or 4, he started exhibiting, I guess we would say, not normal habits, acting out in class, and he wasn't able to basically function with the other children.
I was on my journey to stop eating and drinking. I was so debilitated by the pain of the trigeminal neuralgia that I couldn't do life.
It was an everyday thing. I was walking down a hallway that had no lighting. It was under construction, and I impacted a glass wall with my face and received a severe concussion.
For autism, the spectrum is really large. For Dean specifically, he a lot of times just speaks in like 1 or 2 words to express himself. He'll say like, I'm hungry, or my head, he'll say something like that.
The bullet got through the lung and then stopped on the spine.
We got hit by a couple of bombs, a couple of explosions, and it tore up my back and my neck and my head.
I started to have problems with vision, headaches, nausea, vertigo,
PTSD, pain, anxiety.
He's really sensitive to pain. If he falls down or he gets hurt, it's amplified for a child with autism.
I was going through occupational, speech, physical therapy, neuro-ophthalmology.
And I came to a point to where I sort of hit a plateau and just wasn't getting any better.
I wasn't getting any results with anything.
Whatever I knew as life was no more.
It was in a very bad place. I was definitely suicidal.
And my wife said, I think I found the answer for you. And it's in New Mexico. A doctor called Dr. Howe, and he gets people better.
I was definitely open to the idea of neuroacupuncture. That's how I came to Dr. Howe.
The Hows and what they know how to do changes your life.
It's been 8 years since I first released the documentary 9,000 Needles, a film which chronicled my brother Devin's unconventional journey as he fought to recover from a devastating stroke. After witnessing firsthand the amazing results of acupuncture and a healthcare system which successfully integrated Eastern and Western medicine, I couldn't help but ask myself, why do we have to travel all the way to China to get it? And why isn't this life-changing medicine available to us right here at home?
I couldn't live even like this in my leg.
Sure. All right.
I'm about to find out as I meet some of today's leading healthcare practitioners who are at the forefront of rethinking and remodeling acupuncture's role in today's modern medicine.
Congratulations for your life back. Yeah. All right.
To have the experience to walk into an office and within 30 minutes have somebody lower my pain from a 20 to a 2, I just cried.
After his first treatment, somebody said, "How are you feeling?" And he just said, "I feel more like myself." It just felt like it was something that came from a place in him that I never heard before.
My whole body just sort of melted into the seat, into the chair. It gave me hope, gave me absolute hope.
And that night, I slept through the night for the first time in a year without waking up. And I literally felt like my life was back on track and I was going to get better.
Okay, back to slides. Ooh, look at that. Anyway, and you can see the movie is mostly treated patient, me and my wife, Dr. Linda Howe. They were teaching our school also. The movie, how my associate Thomas is there, give speech as well. I will introduce him a little bit. Let's talk about a little bit more disease and give you an example. It's very short. So I like to ask you, how many of you confident if you meet people have the stroke paralyzed? They meet the people have MS, loss of balance. You have Parkinson's, shaking. You have the brain injury. They cannot understand anything you do. Do you ever make their life change, improve that, even make them become normal? If you don't have confidence, I will highly recommend you need to take our class. And you will change your life and change patient life. That example, in 2006, there's a 2 war, Afghanistan war and the Iraq war. Ooh, Afghanistan is bad news every day now. Sorry about that. Anyway, we have a lot of shoulder get injured. In that time, in Washington, D.C., Walter Reed, medical center, there's a 450 shoulder lost limbs. Like a corner, there's a few of them, but they left phantom pain. West Madison Hospital did everything procedure, heavy duty drugs and surgery, everything, nothing worked. Government in that time say, we need to find an alternative way, give you money, find an alternative way to treat it. They found out acupuncture may help. They searched the whole country and found out us to teach scalp acupuncture. So 2006, I was there and they treat 7 of them. And after just one treatment, 3 of them complain no pain in front of all the neurologists from Army, from Navy, from Air Force. They want to demonstrate, see the demonstration, they learn that. This one complain pain-free in 2 minutes. This one paralyzed and have the pain, have CRPS, get up to walk. This one screaming, yelling for months, no pain after one treatment. So after that, all the neurologists in the Army, Air Force, Navy, they learn 2 days. I only teach them 4 points. I don't teach them very much. They never learn acupuncture. They did 2 clinical trials, proof that works. That's just an example. So only one treatment, 43% recovered, 43% significant improvement, only 1 hour work, getting to 86% recovery rate. We are in the cover page strap. Since then, I've been traveling all over the world. Oh, they come out, the English or Chinese come out. Anyway, if you want to know about this, just type in Yijing pain, Jason Howe. The article should be come up. That's the patient I treated in 2009, had stroke for, I don't remember, I think it's 7 months, and lifestyle paralyzed, and aphasia can now talk, balance off with the cane. And after one treatment, look at this. And he's standing, he's talking, he's walking on the parking lot. I have to hear her film. We don't have time. You just see none of acupuncture modality like a ear acupuncture, body acupuncture, you have this result. Stroke patient, excellent results. Okay, you want to more about this, go to our website, Neuro-Acupuncture-Institute.org. There's a plenty movie for you to learn, to review. It's free. Don't forget. And when you learn that, repeat the results. Don't forget your teacher. And your supervisor, like Thomas. And we treat many multiple sclerosis and have at least 20 of them, no symptoms. For example, that 65 years old lawyer have 20 years MS, 12 years disabled. After 3 treatments, he has severe fatigue, balance, walking trouble, double vision loss, almost a little blind, and weakness both legs. And after 3 treatments, all clear up. Okay, after 4 treatments, back full-time job. Do I lucky? No, I have 20 more to share. Lately, we treat a lot of kids that have cerebral palsy and autism. That's the kid I treated from Amarillo, Texas. When I started treating him, he was 6 years old and never spoke clearly, and no people understand him. His arm is so weak, and when he tried to write, it's nothing in the paper. So after 3 treatments, he started to talk, walking, balance, jumping. After total 14 treatments, he completely recovered. That's the most needle I put for the motor sensory, I put 1/5 motor and speech. I published his cases, same month was published. I write a case report, they published. He is a 30 now, normal kid. Look at that. Lately, like, we treat more and more CP kids from all over the world. That 5 of them, I select them, they completely return normal kid. Autism, even more exciting. The one kid in the movie, he only got 4 treatments. My wife treated him twice. I treat him twice. He can sing, he can talk any way he wants. It's in the movie. Okay, please make him there. Give him some up. I think the lecture, the talk is all about that. Now I give you 20 minutes speech before we started. What's in your mind? I can read your mind. You probably ask yourself, you can do it. You learn 8 years. You do 39 years. Can we do it? I want to introduce my associate and Dr. Thomas Hodge. All right, come on.
Great. Hi, everybody. Good evening from Santa Fe, New Mexico. And I can share a little bit about my story and working with Dr. Howe. And I guess it all started about 8 years ago. And he and Dr. Linda Howe were teaching a 2-day workshop here in Santa Fe. And the Acupuncture College was hosting it, but there were just too many people that signed up for it. So they moved it to a larger place, an auditorium, to accommodate the 134 or so folks that were there. And so I approached the school to see if there were any volunteer opportunities, and there were 3 slots, and I got one of those. And just helping sign folks in, helping with the patient demonstrations, and that's where we met. And it was just amazing to see what they were doing. You know, to see people in wheelchairs, and and I was helping them up there, people in wheelchairs and in crutches, and just to see them get out of those contraptions and able to walk and reconnect with their body again. And I thought, this is what I want to do. I mean, this is what we all signed up to do, help people. And that's why we're in this medicine, because we've got tools that we can actually, help people change. And so when I saw what they're doing, and I was like, okay, I'm committed. I want to do this. And somehow, I don't know how this happened, but then Howe approached me and said that he's going to be looking for an associate in about a year or so, and would I be interested? Of course I'd be interested, I said. And we exchanged numbers, and I just was sharing, just cases, what was going on, and people I was seeing, because I was at a community acupuncture clinic at the time, and folks were coming in, and they were struggling with neurological disorders, and of course back pain, etc. And I wanted to do something about this, and so I was experimenting and throwing in foot motor sensory, doing the best I could, things that I remembered from the 2-day workshop. And folks were shifting and changing, and I remember just sharing that with Hal one day, and then the rest is history. And so that was 8 years ago. And now for 7 years, I've been in the office, and I've been seeing folks like this and watching them change. And just last semester, I had the great fortune of teaching at the Acupuncture College and running a specialty clinic. And we were focusing on scalp acupuncture, of course, and work with neuro disorders. And so I had 5 just amazing students, and each one of them was able to do this. And I thought, okay, if I could do this, and if I could share this, and I can teach this, and these 5 students are affecting and changing all of these lives, it's like, oh my gosh. I mean, what we're doing here at the Institute has been so much fun and so amazing. And see, what do we have? I mean, we have over 100, I guess, certified folks now, or 90. Well, I mean, who have gone through all of it for level 3. For level 3, yeah. And yeah, and so every day too, and just sending people, who come in and say, do you know anybody out there in San Francisco area? Do you know somebody in Ohio or up in Connecticut? And say, well, let's pull up the website and let's see who's there. And sure enough, we've got people all over the country and now all over the world. We've got folks. And so it's been a lot of fun. And so and so rewarding. And I've been seeing a lot of folks now, post-COVID. And like Hao said, of course, smell and taste, tinnitus is a big one. Of course, foggy headed, even some situations where after a vaccine, people are having some issues and being able to help them through that. And yeah, Parkinson's has been a great one. Trigeminal neuralgia, I think that's probably one of my favorite ones to work with, because it seems to be, they're all really responsive, but that one, I can just guarantee so far with everybody who comes in with a trigeminal neuralgia issue that we can change this pain situation. With tinnitus, ringing the ear, Bell's palsy, which can also be a post-COVID situation. And that's been really responsive. Yeah, stroke. I just recently, the past 2 weeks, had he's in his early 70s, 74, 75, amazing piano player who had 2 strokes this year. And so he's come in, his wife brought him in, and I really love it when they're a bit skeptical and they're saying, I don't know if this is going to work. And yeah, sure, a few needles. And this guy, he had poor balance, dexterity, fine motor skills, speech and swallowing issues. And so I saw him again today, and this was his second treatment. His balance was so much better. He's thrown that skepticism out the window. He's just really excited, and his wife is just like, I told you. And so he's,
2 thumbs up.
Yeah, 2 thumbs up. Yeah. Yeah. So the whole reason why I'm sitting right here in front of all you guys is just to tell you that it's not just the Hows who can do this. And apparently it's not just me who can do this after learning and working with the Hows, but it's everybody. So it's teachable, it's learnable, and we can all do this, and we can all just change the landscape of acupuncture, integrating into the world of all medicine and being an effective tool, but an effective diagnostic, effective practitioners, and just really great people, and so yeah. So thank you everybody for coming out tonight and listening to my teacher and mentor, and see Asia and listening to me for these 3 minutes. So thank you so much, everybody, and I'm giving it back.
Everybody put some up. Thanks to Thomas. He worked a whole day, the whole book, and he booked every day. You will have waiting list, and Thomas buy his first house last year. So they were successful to see this technique not only change patient life, return their life, they change their entirely professional life. We want to share, we want to everybody know that, so we can teach more Western medicine about that, inform that there's a new way can change people's life, make a lot of disabled and condition change. However, this technique is new, only 50 years, compared 3,000 years Chinese medicine. So we need everybody here tonight, unite together. So in the future, we can do more clinical trial, research, find what's going on. We put 2 needles, they're talking. We put 3 needles, they're walking. There's something going on in the brain, guys, right? So, and if you want to, our next, join our class will be March 26, 28, and 2022. And go to our website, you get all the informations, and you may can contact all the other people too there too. So Neuro-Acupuncture-Institute.org. I think I will give you 5 questions. I know question will be endless. And then Jeffrey read for me, I'll give you answer. And so most of the question, you get a question. That's not my book, I'll tell you. All your questions will be answered in this textbook. And very reasonable price. Everybody think I'm rich by write a book. Each book I only get $2. Okay, so nothing. But this set are pretty good. Printed in Blue Poppy Press. Okay, and 1/3 talk all the technique, and 2/3 all the cases in America treated, and all of them recovered. I even have people complete coma, I bring their life back. Okay, they're all techniques there. Now let's answer some questions.
All right, and Dr. Howe, we actually have a lot of questions that we're not going to be able to answer. Would it be okay if I sent you the questions offline, and maybe in a week or two you could send them back to us with some answers?
Oh my God! Maybe we should have another.
We might need a part two.
For me, just hold another workshop, answer all the questions. So, how many questions there?
There's a lot. So let me just ask a few, and then we'll let everybody go for the night. Let's see. Is it possible to relate the apex location of the motor area in regards to do 20?
You know what? If you want to learn this, everybody's brain different, so it's very difficult. If you really want to that, do 20 almost close to sensory areas. Or when I teach, especially Western medicine doctor, how they relate to 20, I usually don't give answer. The people more confused. So I think don't forget from the middle point, occipital protuberance, if I do it. So right here, middle point, pulse half centimeter is your motor areas, okay? It's more accurate. It's a total different. You get a better result. Next.
Utility of neuroacupuncture for anosmia, dysgeusia, and brain fog.
You cannot smell, and then you use lower 2/5 sensory areas. Okay, that's a good question. So lower 2/5 sensory is number one we call primary smell taste area. Taste and smell for in the brain is the same area. That the primary areas. Our teacher a gift because who asked the question? There's a secondary smell taste loss areas from the top of the ear until 2 centimeters. There's another point that go to 3 centimeters down. That's very useful. You can do this right here and do both sides. They work for that too as well. Okay, all right, next.
And actually a follow-up to that question, how often would you have to treat somebody to get their sense of taste and smell back?
Ideally, it will be 2 or 3 treatments per week, but both me and Tommy were too busy. We just cannot see them, and we only see them once a week, and every other week, that pretty much we can do. I do once a week, they still get a good result. So by ideally, treat them 2 or 3, and then when they get better, you can see less. And for stroke, for MS or Parkinson too, 2 or 3 is better, but I treat them once a week. However, it's different. People all the way fly here from Dubai, Australia, they pay all the flights, stay in a hotel, eat in a restaurant. I do treat them every day. Okay? All right. Okay, next.
All right, next question. Do you ever combine body acupuncture with scalp acupuncture?
Yes, I do. My figures. So most condition, you want to do scalp first, okay? After this, where? Oh, sorry. After you do 5 treatment, they are either don't get a flat toe or people paralyzed. For example, their arm move up better, but their hand doesn't move. Then you add body acupuncture. For example, the arm paralyzed, you do LF4, Sanjiao 5, LF11, LF14, 15. And you do leg, you do goblet 34, 31, 30, stomach 36, spleen 6. Okay? All right? And you can use electricity stimulate for this body point as well. Next.
All right. Next question. Can you please repeat what the GV24 triangle point combination is for, please?
Now you can see it. So from hairline, middle point, you put 1 point in the center. And then from pupil, go up. There's that liver and stomach point. From this point to middle point in the center is a chest point or thoracic cavity point. So you put 1 needle here, 1 needle here, 1 needle here. Basic, you do 1 needle inside, 1 needle from here. Another needles is like that. Okay, another needles like that. So the inside is triangle. Okay. All right. Next.
All right. How about one more question? Could you use e-stim instead of manual stimulation?
I'm not, when I come United States 32 years ago, I say no. Now I changed. And people don't have time to practice that 2 months menus. And also I teach a lot of MDs and Ham's Medical Institute. I teach a 25 workshop for them. So MD doctor, they don't have anxious effort to do that. So they use electricity stimulation. Yes, you do. So electricity stimulation also used now is for clinical research because manual, you just cannot control the quantity or quality of your manual stimulation. Outcome you cannot compare. So for scalp acupuncture, if you use electricity machine, not a TENS machine, okay? Electricity machine, you use high frequency, less intensity. High frequency means you go to 60 to 200 hertz, okay? When you have the machine, you almost cannot see it, they are shaking. Lower intensity means people just feeling a little bit sensation, it's good enough. And mostly I use 1 pair, and you can use 2, not more than 3. The brain is so sensitive, you don't know how they are affected. For children, no electricity stimulation, and they hate it. Okay, you shock them, they never come back. They'll kick, they'll bite your finger off. Okay. Okay, next.
All right,
One more?
all right, let's do one more. Give me 1 second to get a good one for you.
I think I have 2 minutes.
Okay, let's see. Do you have any point suggestions for thalamic stroke pain syndrome?
What? One more time, what syndrome?
Thalamic stroke pain syndrome.
Thalamic. You use foot motor sensory, upper 1/5 sensory, and use the chest area do this way in the middle. That's 3. Okay. All right. I'm sorry I cannot answer your 100,000 questions. Even my own student, I just cannot do it. I have my life. I'm very busy, and level 3 class come out next week. I teach 2 or 3 days. I don't have time, but get the book and go to our website. Look at all the movies. So I do this. I learned 8 years, do this 39 years. You're not going to learn that in 1 hour. So it's the truth, okay? So I do the best I can. But I will give you, after class, I'll give you Thomas' home number. You can call him. Middle night, he will be happy to answer your question.
Oh, thank you so much, Dr. Howe. And thank you to Thomas, and thank you to Asia for all of your assistance. This was incredible. Yeah, Asia, please just come and say hi to everybody. This is the woman behind the
Asia, Jeffrey, and Lisa, OM at the class put all together. It's very short. And that's it.
Oh, hi there. Thank you so much for coming. We really appreciate it. We're very excited about having this event. We hope to have many, many more. And please email me too if you have any questions about the Institute itself or about the class or anything like that. It's ashia@neuroacupunctureinstitute.org. And thank you so much, everyone, for coming. Dr. Howe always loves teaching in new venues, and we hope this will become a regular thing. Thank you so much.
We do too. So our next webinar is also going to be on neuroscience, and it's going to be the Neuroscience Acupuncture Conference Sneak Peek featuring Michael Corradino and some of his panelists from their conference. That will be happening on September the 14th. So check out our blog for registration, and definitely check your email 5 minutes after for links to the video and links to the Neuro-Acupuncture Institute. Everybody have a great evening.
Have a great evening. Stay safe,
Thank
everyone.
you.
Thank
Bye,
you.
everyone.
Goodbye.
Thank you.